Hi, my name is Martin Lee. I'm a consultant rheumatologist working in the northeast of England. I have a specialist interest in young adult care and also have an interest in managing arthritis in pregnancy. I also have some personal experience of this too. My wife has rheumatoid arthritis and has given birth to our daughter despite having active disease and requiring biologic therapy. Our daughter is now 2 and my wife is currently pregnant with our second child. Lots of young women ask me if they can still be a mum if they have arthritis. They have all sorts of concerns. Will the medications they're taking affect their baby? How will the arthritis be during pregnancy? Will they be able to look after the baby when it arrives? Will they pass on arthritis to their baby? The fact is that in the vast majority of cases, there's absolutely no reason why you can't still be a mum if you've got an arthritis. It just might take a little bit more time and planning than if you didn't. So, there are a couple of important things to think about if you have an arthritis and want to be a mum. The first thing to remember is to tell your rheumatologist or rheumatology specialist nurse as early as possible that you're thinking about having a baby. This will give you and your rheumatology team plenty of time to think about the best medications to use to treat your arthritis. It will also ensure that your medications that you are using are safe to get pregnant on and reduce the chances of needing to change your medications at a later stage. It's all about planning ahead. Don't worry or feel embarrassed if you know you want to be a mum in the future, but maybe not for a few years. It's never too early to tell your rheumatology team and start that discussion. The second thing to remember is it's really important to make sure that your disease is as well controlled as possible before falling pregnant. This will increase your chances of falling pregnant when you want to. It will also help to ensure your baby is healthy. Again, your rheumatology team can help you work towards these goals. Fertility is a word we use that means your ability to fall pregnant. Arthritis itself, if well controlled, shouldn't have much impact on your fertility. If your arthritis is very active and there's lots of inflammation, your body will be working to control that inflammation. In this situation, it may be that your body will forget about creating the best conditions for you to fall pregnant and nurture your infant. So, the key is to get your arthritis under control first, if possible. Aside from the arthritis itself, there are a few medications that can affect fertility. Moderate dose steroids, for example, or high dose anti-inflammatories can reduce fertility. And there are medications that we use to treat arthritis that are not safe to fall pregnant on, such as methotrexate. However, it doesn't mean that you can't get pregnant, it just takes a bit more planning and potentially stopping or switching medications. Ultimately, if you're thinking about having a baby, or you think you might want to in the future, it's never too soon to talk about it with your rheumatology team. They can explain the effects that different medicines may have on fertility and work with you towards getting your arthritis under control before you begin your pregnancy journey. The right time to have a baby is different for everyone. It's true that a woman's body is better suited to falling pregnant at a younger age, but it doesn't mean that women can't have a baby later on in life when it suits them better. Having arthritis doesn't change that at all. The only difference, if you have an arthritis, is that it's always better to plan your pregnancy if you can. That's why we recommend you think carefully about contraception, especially on some medications. Of course, we know that pregnancy doesn't always happen when you plan it. If you do find yourself pregnant and it wasn't planned, just be sure to tell your rheumatology team as soon as possible. The chances are everything will be fine, but it's good to check. The vast majority of children born to women with arthritis will not have arthritis. For example, rheumatoid arthritis affects about 1% of the population. If you have rheumatoid arthritis, it will double the risk of your baby developing rheumatoid arthritis at some point in their lives. This means that there is still a 98% chance that they won't ever develop arthritis. Obviously, there are lots of different types of arthritis, but the vast majority are not hereditary and aren't passed from mother to child. Of course, no one can guarantee that your child won't have an arthritis. It's important not to blame yourself if they do. It's not your fault. Also, the treatments we have available now for arthritis in childhood and adulthood are vastly different to those that were available even 10 years ago. The outlook for children and adults who develop arthritis now is much better than it was. It used to be thought that pregnancy had a beneficial effect for lots of women with rheumatoid arthritis or juvenile idiopathic arthritis. We now know that this isn't the case. It is true that in about 50% of cases, the arthritis settles in pregnancy, but this means that in about 50% of cases, it doesn't. I see a lot of women whose arthritis does settle down in pregnancy, but I also see a lot of women whose arthritis does flare in pregnancy as well. Pain in joints and muscles during pregnancy is very common whether you have an arthritis or not. Women develop pain in the lower back, hips and knees because they are carrying around a heavy lump in their tummy. Their body is also changing and preparing itself to deliver a baby. So, if you experience pain during pregnancy, it may not be related to your arthritis at all. The key thing throughout pregnancy is to keep close contact with your rheumatology and obstetric teams and your midwife. There are lots of treatments that we can use safely during pregnancy if necessary. For example, steroids can be helpful and they are safe to be used for short periods of time. It is very common for women to worry about the medications they are on when they're considering getting pregnant and what effect they may have on the baby. Whether you decide to continue, change or stop your medications throughout your pregnancy is a very individual decision. It will depend on what type of arthritis you have, how active it is and what medication you're on. It is a decision you can make together with your rheumatology team. There are some medications that aren't safe to conceive on, so these may need to be stopped. It's important to discuss this early on, as it may take up to 6 months for some medications to work their way out of your system. Sometimes medications that are safe to fall pregnant on may need to be stopped later on in pregnancy. This is to reduce the risk of affecting the baby's immune system and potentially making them more vulnerable to infection when they are born. However, we now know there are also medications to treat arthritis that are safe to fall pregnant on and to continue throughout pregnancy, even some of the biologic medications. Again, it's really important to have a conversation early on with your rheumatologist or rheumatology nurse specialist so that you can plan in advance. Arthritis shouldn't affect labour in the vast majority of cases. It is still perfectly possible to have a normal vaginal delivery, and usually there is no increased risk of caesarean section if your arthritis is well controlled. In some unusual cases, where the arthritis is severe or there has been significant damage to the hip joints, a caesarean section may be recommended. It is also important to know that your obstetricians may classify your pregnancy as high risk, even if your arthritis is well controlled. This may mean that they would prefer to deliver your baby on the ward rather than in a birthing centre, just in case there are any unforeseen problems. I would recommend discussing this with your midwife and obstetrician early on. It is true that flares are more common in the period after the baby is born, especially for some types of arthritis. It's a good idea to keep in close contact with your rheumatology team at this time, so that they can help if your arthritis does flare. Fatigue is also really common throughout pregnancy, and particularly after the baby is born, whether you have arthritis or not. It's very hard work looking after a newborn baby. To stay as fit and strong as possible, it's important to make sure that you look after yourself during this time and get as much help as you can. If it's possible for you, build a support network around you and your partner before the baby arrives. Don't be afraid or feel guilty to ask friends and family to help out in the first few months. Let your partner do as much as they can too, to take the strain off you. Everything that you do to look after yourself is ultimately about looking after your baby too. Breastfeeding can be a really difficult thing to do, whether you've got arthritis or not. A lot of women who don't have arthritis want to breastfeed, but unfortunately can't due to a lot of different reasons. There is no reason why you shouldn't breastfeed if you're physically well enough to do so. There are also a lot of medications, including some biologics, that are considered safe to take whilst breastfeeding. However, if your arthritis is really active, you may decide to start with medications that aren't considered safe for breastfeeding. For example, breastfeeding is completely possible and safe whilst taking some doses of steroids, but it is not considered safe to breastfeed while taking methotrexate. If you find it too painful or too exhausting to breastfeed, there are other options. For example, using an electronic breast pump to express milk may mean that you don't need to hold your baby for long periods of time, and other family members can help with the feeding. If breastfeeding is just too much to cope with, don't do it. There is no need to feel guilty. Plenty of mums can't breastfeed, and there are lots of other options available to nourish your baby. There are two key messages here that I'd like you to take away. Talk to your rheumatology and obstetric teams early about your plans and what you want to do about breastfeeding. If you can't breastfeed, for whatever reason, don't feel guilty. The first thing men with arthritis should know about starting a family is that there is no reason why they can't be dads. Arthritis itself should not affect fertility. However, just as for women with arthritis, it's important to have a conversation early on with your doctor about starting a family in the future. This is so that your doctor can advise you about your medication. For example, one medication, sulfasalazine, can cause a temporary fall in sperm count. Current guidelines say it's not necessary for men to stop taking sulfasalazine before trying to start a family, though if you've been trying for more than a year, you should discuss this with your doctor. You may also have heard that men taking methotrexate should not get their partners pregnant, in case it causes harm to the developing baby. This used to be the advice we would give, but is no longer the case. The most recent guidelines state that the doses we use for the treatment of rheumatology conditions in men are considered safe and would not harm the developing baby should a pregnancy occur. The important message to take away here is to talk to your doctor early on about whether you'd like to have children in the future, so that together you can work out the best treatment plan for you. If you have any questions about your arthritis and pregnancy, either before you get pregnant, during your pregnancy, or after your baby is born, you should speak to a member of the rheumatology team. If you have lots of questions, write them down so you don't forget. Remember that you can ask any question at all, and don't feel embarrassed about anything you may want to ask. Other people you may wish to talk about more general things include your midwife or health visitor, your GP, and of course your family and friends. Good luck.